Hello there. Thank you for taking the time to watch this video. Did you know that every 40 seconds, someone in the US has a stroke? And here's something even more concerning. After the age of 50, your risk of having a stroke doesn't just rise, it multiplies. This might sound serious, but the good news is that it is preventable. Today, I'm going to share with you 7 hidden stroke risks that many of us don't even realize, but they can have a profound impact on our health, especially as we get older. These factors may be silently affecting your health without you even knowing it. If you find this information helpful, don't forget to subscribe and hit the notification bell so you never miss more videos that can help you live a healthier life. Share this video with your loved ones so we can all protect our health together. Let's dive right in. 1. High cholesterol and arterial plaque, the silent enemy. High cholesterol is one of those dangers that often goes unnoticed until it's too late. When your cholesterol levels rise, it's not just a number on a lab report. Excess cholesterol builds up as plaque inside your arteries, which reduces blood flow and leads to blockages. Imagine your arteries as roads. When plaque accumulates, those roads become clogged. Blood can no longer flow freely, increasing your risk of a stroke. So, how can you reduce this risk? The first step is changing your eating habits. Start by adding healthy fats from foods like olive oil, fatty fish like salmon, and avocados. These foods help lower bad cholesterol and protect your heart. Also, try to cut back on fried foods and focus on increasing your intake of fiber-rich foods like nuts, beans, and oats. Not only do these foods help reduce cholesterol, but they also support the process of clearing plaque from your body. Remember, small changes in your diet can lead to significant improvements in your health, helping prevent stroke and heart problems. The key is consistency and sticking to healthy habits every day. 2. High blood pressure, hypertension, the silent killer. High blood pressure is one of the most dangerous silent killers because it often has no symptoms, yet it quietly damages your arteries, making them weak and prone to rupture, which increases your risk of stroke. Preventing high blood pressure is simpler than you might think, and it can be incredibly effective. The first thing you can do is reduce your salt intake, as too much salt raises blood pressure. Focus on eating more vegetables, bananas, and potassium-rich foods, as they help balance your blood pressure. Regular physical activity for at least 30 minutes a day is another effective way to manage your blood pressure. Activities like brisk walking, swimming, or cycling are excellent choices. And don't forget to check your blood pressure regularly to catch any issues early and prevent problems before they arise. Managing your blood pressure doesn't have to be complicated. Small changes in your lifestyle can go a long way in protecting your health and reducing your risk of stroke. 3. Obesity, a heavy burden on your heart and blood vessels. Imagine carrying a heavy bag all day long. The constant strain, the weariness. You can probably feel it just thinking about it. That's exactly what excess weight, especially belly fat, is doing to your body. It's not just about how you look in the mirror, it's about the internal pressure it's putting on your organs, particularly your heart and blood vessels. Think of that extra fat as an invisible weight that grows every time you eat poorly or skip exercise. The more you neglect your health, the heavier that load becomes. One of the most serious consequences of being overweight is its impact on your blood pressure, cholesterol, and blood sugar, all of which increase your risk of a stroke. I remember one patient who shared, "I didn't realize how bad it had gotten until I started feeling out of breath and tired all the time. That's when I knew I had to change." And change he did. He started eating healthier, exercising regularly, and shedding those extra pounds. The good news? You can absolutely control your weight. Losing weight isn't a race, it's a marathon. Small, consistent changes in your eating habits and physical activity can drastically improve your heart health and lower your stroke risk. The key is patience and taking care of yourself every day. Over time, those small changes will add up, leading to a healthier, happier you. 4. Diabetes, the silent danger. Diabetes might not cause immediate pain or obvious symptoms, but it's a silent killer. This disease doesn't just raise your blood sugar. It quietly damages your blood vessels, making them weak and more prone to blockages. And as you know, when your blood vessels are damaged, the risk of a stroke skyrockets. I had a patient once tell me, "After being diagnosed with diabetes, I just felt worn out all the time, like my energy was drained and my memory was slipping." That's the subtle, insidious effect diabetes has on the body. What's even more concerning is that diabetes often comes hand in hand with high blood pressure and high cholesterol, creating a dangerous trio that significantly increases your stroke risk. Imagine diabetes as one piece of a bigger puzzle. When combined with high blood pressure and cholesterol, it makes your stroke risk much higher. But here's the empowering part. You have control. By sticking to a healthy diet, exercising regularly, and checking your HbA1c levels, you can effectively manage your diabetes and reduce the risk of a stroke. Think of diabetes like a sneaky enemy that you can outsmart by taking charge of your health. By adopting a healthy lifestyle, not only can you manage your diabetes, but you can protect yourself from more serious health issues like strokes. Taking care of your diabetes isn't just about managing blood sugar. It's about safeguarding your brain and keeping your body strong and vibrant for years to come. 5. Atrial fibrillation, AFib, raising stroke risk by 500%. Atrial fibrillation, or AFib, is one of the most dangerous heart conditions that many people don't even realize they have. It causes the heart to beat irregularly, sometimes too fast, sometimes too slow, disrupting the normal flow of blood in your heart. As a result, blood clots can form and travel to your brain, causing a blockage in the blood vessels, which can lead to a stroke. I once had a patient who had AFib without knowing it. He told me, "I just felt tired all the time, but I never thought it had anything to do with my heart. It wasn't until my doctor discovered I had AFib that I realized how dangerous it really was." And in fact, if left undiagnosed and untreated, AFib can increase your risk of stroke by up to 500%. The good news is, we can manage this condition. Make sure to have regular checkups for your heart health and take blood thinners if prescribed by your doctor. Maintaining a healthy lifestyle with a balanced diet and regular exercise can also help lower the risk associated with AFib. Don't let heart issues silently threaten your health. Start taking care of your cardiovascular health today to protect your life tomorrow. 6. Heart disease. The silent stroke. Trigger. Have you ever stopped to think about how much your heart impacts your overall health? We often overlook heart health, but when it comes to stroke, the heart is often the silent culprit. Conditions like atrial fibrillation, AFib, and coronary artery disease can significantly impair blood flow, increasing the risk of stroke. When your heart isn't beating properly or your arteries are blocked, the blood can't flow freely, putting undue pressure on your brain. I once had a patient who never realized the condition of his heart until he experienced a minor stroke. He said, "I always thought my heart was fine because I never had chest pain. But when I had that stroke, I realized things weren't as they seemed." This story is all too common, and sadly, many heart issues progress silently without clear symptoms. That's why regular heart health checkups are crucial. Monitoring blood pressure, cholesterol levels, and following any prescribed medications are all essential. A heart-healthy diet, rich in fatty fish, avocados, and nuts, can also go a long way in protecting your heart. You absolutely can protect your heart and reduce your stroke risk. Make exercise a habit, eat well, and most importantly, listen to your body. Don't wait until it's too late to take care of your heart. 7. Sedentary lifestyle, a key stroke risk factor. Ask yourself, when was the last time you stood up and moved around? In our modern world, we're sitting more than ever, whether working, watching TV, or simply scrolling on our phones. But did you know that sitting for prolonged periods and not getting enough physical activity is one of the biggest stroke risk factors? Lack of movement doesn't just raise blood pressure. It also affects cholesterol, blood sugar, and weight, factors all closely tied to stroke risk. I've seen this firsthand with patients who lead sedentary lifestyles. They don't realize the impact until their bodies start to react. Sudden fatigue, shortness of breath, or just general discomfort. One patient once shared with me, "I thought sitting all day was fine because I ate well, but it wasn't until I felt exhausted, struggling to walk, that I realized how wrong I was." This is the kind of toll inactivity can take on your body. The good news? You can turn this around. Just 20-30 minutes of physical activity every day, whether it's jogging, swimming, or biking, can significantly reduce stroke risk. Small changes, like taking the stairs instead of the elevator or standing up to move every hour, can make a big difference over time. The key is to stay consistent with daily movement. It not only lowers your stroke risk, but also helps you feel healthier and more energized. Start today. Finally, I want to emphasize that our health is not something distant or beyond our control. Every small change in lifestyle, whether it's your diet, exercise routine, or regular health checkups, can make a big difference. You might not realize it, but these habits will help protect your heart, safeguard your brain, and prevent the frightening risks of stroke. Remember, you have the power to take control of your health. Don't wait until symptoms appear or problems become serious before you take action. Start today, and those small steps will lead you to a healthier, more active life full of joy. If you found this video helpful, don't forget to subscribe, turn on notifications, and share it with your loved ones so we can all protect our health together.